Hi, Dr. Saxena here, Chief Medical Officer of Form Health. I'm excited to tell you more and more about BrainRx, but one thing that we do want to make sure is we want to let you know if you might be somebody who could do BrainRx, but we would need to have you see a provider first, meaning you wouldn't do the BrainRx program all by yourself with a coach. So this is an important list because we do recognize that there's a continuum of issues that relate to the brain, and you might be more towards the mild to moderate size, in which the BrainRx program with coaching supervision is really an ideal choice. But if you're going to fall into a category that we might call moderate to severe brain symptoms, then we want to make sure that there is a provider involved so that you are managed most safely. So that would mean that you would set up an appointment with a Form Health provider who would then personalize BrainRx or another solution based on their evaluation. You would not sign up for BrainRx by yourself. You would let the provider make that choice after having a full consultation with you. So here are the major categories that I want you to consider getting a provider involved before signing up for BrainRx. Number one, if you are the parent guardian of a child under age 15, we really like to make sure a provider is involved. If you or the patient that you're thinking about BrainRx for has little self-awareness or the ability to self-assess, like perhaps their brain issues make it hard for them to track their symptoms or their progress, again, we might want a provider involved to be able to help with that. If you have moderate to severe symptoms, whether they're mental health or cognitive health or physical health, we just may want to have a provider involved. So that might be something like, let's say if you have any issues with mania, psychosis, schizophrenia, paranoia, seizure disorder, kind of blood pressures that skyrocket rather uncontrollably, let's say from anxiety, for example, all those are conditions that we would modify BrainRx, but a provider would have to modify those. That wouldn't be a great coach supervised choice. The other thing is if you tend to kind of, if you will, bottom out with your blood pressure, or maybe you're on multiple psychiatric or brain medications. So if you happen to be on, 2 antidepressants and a sleep aid and an anti-anxiety as needed pill, now we're getting into complex drug interactions and we want to have a provider involved. So if you're on something like an anti-anxiety medication, but you're taking it sparingly and you have mild to moderate symptoms, you could do the BrainRx program with health coaching. But if you also happen to be on an antidepressant, an antipsychotic, which sometimes is used for resistant depression, or let's say you're on stimulants and some heavier doses of stimulants for a ADHD diagnosis, or maybe a mood stabilizer. Those are the kinds of things that we would want a provider involved versus you doing BrainRx alone with a coach. Also, if you happen to be getting active prescriptions for a substance use disorder, for example, if you're on methadone or something that prohibits you from taking pain medications, we'd want to make sure that there is some safety nets involved with your program. So I hope this helps you understand who would not be a good choice for BrainRx with coaching supervision alone. Again, BrainRx may be a good choice, but we'd have to get a provider involved to make sure that we do it most safely so that you get the most efficacious results. Take care, and I wish you the best of brain health always.